Obsessive compulsive disorder, OCD. It can be asked as a 4-marker in our university examinations. And here I have taken my points from Mandapa, Manipal Manual of Medicine. So let's start. What is this OCD? Obsessions are persistent, intrusive thoughts, and compulsions are intrusive behavior. So intrusive thoughts and intrusive behavior that together comprise obsessions and compulsions. And in obsessive compulsive reaction, an irrational or impulsive idea that persistently intrudes into the mind and that will lead to repetitive actions. For example, washing the hands many times, like cleaning the seats many times and all, so etc. We know in different movies and all we have seen the scenarios. So, in the obsessive compulsive reaction, an irrational or impulsive idea that will persistently intrudes into our mind and that will lead to repetitive actions. And these actions are recognized by the individuals as absurd. They know it's absurd, but anxiety is only elevated by doing that ritualistic performance. So, that's why they are doing it. These actions are recognized by the individuals as absurd, but anxiety is elevated only by ritualistic performance of the action. Under extreme stress, these patients may exhibit paranoid and delusional behaviors, and it can mimic the schizophrenic conditions also. So, under extreme stress, these patients may exhibit paranoid and delusional behaviors which can mimic schizophrenia. And these patients are usually predictable, orderly, and intelligent. Highest prevalence is seen in the young, divorced, separated, and unemployed individuals, and males and females are equally affected. And there is a high correlation between the obsessive compulsive disorder and depression. 2/3 of the obsessive compulsive disorder patients will develop major depression during their lifetime. Coming to the management part, exposure and ritual prevention therapy is often effective. Exposure means whatever they are doing, if they don't like the dirty atmosphere and all, exposure to the dirty atmosphere and not allowing them to wash the hands frequently, that is ritual prevention. So they will be having the thought in their mind to do the action, but we have to prevent them by doing that. But it's not that simple, but gradually that will become a good effective treatment. And also antidepressants such as selective serotonin reuptake inhibitors, clomipramine, these are all effective in controlling the OCD. Antidepressants such as selective serotonin reuptake inhibitors and clomipramine. What are the examples for selective serotonin reuptake inhibitors? You can write escitalopram, fluoxetine, paroxetine, etc. So, once again I'll explain the slides. This is a small slide only. OCD. What is obsession? What is obsession? What is compulsion? Obsession is the thought and the compulsion is the behavior. And together they will be having the irrational or impulsive idea that will be coming to their mind that will lead to repetitive actions like washing the hands many times and all. And these actions are recognized by the individual. They know it's absurd, but the anxiety is only relieved by doing that action. And under extreme stress, they will exhibit paranoid and delusional behaviors and which can mimic schizophrenia. And these patients are usually predictable, orderly, and intelligent. Highest prevalence is seen in young, divorced, separated, and unemployed. Males and females are equally affected. There is a high correlation between the OCD and depression. 2/3 of the OCD patients will develop major depression during their lifetime. And management, exposure and ritual prevention therapy, and antidepressants, including selective serotonin reuptake inhibitors and clomipramine. So this is a short module. I guess it's clear. So